Good afternoon, everyone. My name is Jing, and I work in University of Groningen in the Netherlands. And I'm here to present our study. Is gliclazide associated with a lower obesity-related cancer compared with other sulphonylureas? And this is a long-term prospective cohort study. In the literature, we suspect that gliclazide might be associated with a lower risk of cancer. But these studies are limited with some important methodological limitations. For example, retrospective design and limited sample size, and they didn't account for the cumulative usage of the drug. So we aim to evaluate whether gliclazide was compared with other sulphonylureas would be associated with a lower risk of obesity-related cancer. To do this, we linked the data from 1998 to 2014. So in total, 16 years of clinical data from the Dutch primary care linked with the Dutch National Cancer Registration and the Dutch population registration to get cancer and death information. And then after the patient selection, we got more than 26,000 patients included in the final analysis. Obesity-related cancer is defined as those cancer types are known to be associated with obesity or overweight based on the World Cancer Research Fund. And we did a primary analysis use 1 year lag period. That means that if the patient gets cancer within 1 year after using the drug, we discount it as an event. And I would like to introduce about the within-class design a little bit. We compare gliclazide with other sulphonylureas. In the Netherlands, the choice of these four sulphonylureas are generally random based on the GP's preference. So using this within-class design, we applied the randomization, automatic kind of randomization because of the random choice of GP. And when you look at the characteristic of those patients, we can see that gliclazide is more often to be new users. This is because from 2013, in the Netherlands, the Dutch guideline recommend gliclazide over other sulphonylureas. This is because based on we know that the gliclazide has better cancer, relatively lower risk of hypoglycemia and cardiovascular risk. And there are also more patients with smoking compared with other patients, while glibenclamide patients tend to be older compared with other sulfonylurea users, and they tend to have a longer risk duration of diabetes. Glibenclamide is less and less used in the clinical practice in the Netherlands. And when we look at the forest plot, the primary analysis showed that there was we didn't observe any within-class difference among males and females. We also did 4 sensitive analyses. The first one is to include only complete cases. And the second one is to change the lag period from 1 year to 2 years. And the third one is we assume intention to treat analysis. So there were some patients switched from one sulfonylurea to the other one. And we assume that this patient never switched and they used the first sulfonylurea till the end of the usage. And the third one, the last one is new users. So we only do the analysis among patients who are new users. And as you can see that the results are consistent with the primary analysis. Therefore, we conclude that we did not observe within-class difference. This is contrary to the literature, by the way. We didn't observe within-class difference regarding to obesity-related cancer. And the next step is we are still very proud of our within-class design. And the next step would be we would like to evaluate within-class difference of cancer risk, focus on a specific type of tumor instead of overall in general so many cancer types. And thank you for listening.